started working for Northwest Kidney Centers of May of 1991. Well, it was interesting. I've seen dialysis done, but the real attraction was the schedule. At that point in history, there was a real downturn at the hospitals. And there was this position that said, well, you can work 7 days of pay period, and you got 12-hour shifts, and you go to the various hospitals. And I thought, well, that's something new and different, so let's give it a try. There was 8 of us when I started as a staff person. At that time, everything was paper in the hospital. So you would hunt around trying to find the patient's chart. You'd chart on paper, and then you would also get the orders on paper. The highest tech device we had was a pager. We have a staff now of just a little over 60. When I started, we were doing probably about 250 treatments a month, and now we're doing about 1,100 a month. Early in my career here, probably in the first 5 years, Northwest Organ Procurement, or NOPA, was part of the Kidney Center. At that time, we covered Washington, Alaska, parts of Idaho, and Montana. I would be in communication with a remote procurement specialist, say, in Anchorage. And then myself and a surgical tech and a transplant surgeon and a fellow would hop on the jet. We'd get to the facility. We'd immediately race right to the hospital, do the recovery, and fly right back. So it was really a rush against of time. And then you might have a kidney that matches somebody in Florida. So we'd put that on a commercial flight, and away it would go. And you would be surprised on every day how many organs are sitting in the cockpit of commercial airlines. Tom was a really interesting guy. One, you really had to have a picture of his office because there was a chair and a little spot to sit. The rest was paper and books stacked to the ceiling. Great guy to work with, great personality too. And I got to know those folks, Dr. Blagg and him, very intimately because all hours of the night we were communicating back and forth. Far too often in management, we distance ourselves from the staff and we don't walk in their shoes. And I can say I did clinical dialysis 20 years ago, but to walk in there now and understand what those staff go through is difficult. By getting folks that are chronic dialysis nurses, technicians, all of those people amassed together to come up with a unified team it's been a real joy. And we always have to be continuously improving. You might think you're the best, but there are probably other people out there that are either doing it similarly or doing it better than you. So you have to kind of check your ego and really look out for the patients and provide the best possible care that you can.